Hi, my name's Lauren, and I'm here to talk to you about privacy, confidentiality, and data security. And it's kind of strange to me to be talking about this topic while I am, in my home, talking to a bunch of people that I've never met before. So it's made me a new level of consciousness about my privacy. And yet, I'm going to share with you one of my secrets that few people know about me. Okay, and that is that I am a closet Keeping Up with the Kardashians viewer. And much to the disgust of my husband, I am very familiar with all the ins and outs of the lives of the Kardashians, as are millions of people around the world. In this video clip, Khloe Kardashian is in the office of her gynecologist, and she has a surprise transvaginal ultrasound where she discovers that she has fertility issues. This is not the sort of topic that most people share with their closest friends, let alone the broad viewing public of international viewers around the world. And I guess that makes some people think, what does privacy even mean anymore for people like that? But the thing is that even with the Kardashians, they still have a right to be able to choose the information that they keep private and that which they disclose to the public. So, while it was a surprise doctor's visit, I'm sure it was, they had complete editorial control over, the conversation that happened in front of the camera, what went to publication and what angles things were filmed at, things like that. And even with people like Khloe Kardashian, if she was, admitted to a hospital, just because she chooses to overshare so much of her life doesn't give anybody the right to look at her medical file or tell people that she's been admitted to hospital, things like that. So we all draw up boundaries differently. This is an extreme example, but the key thing to remember is that we as individuals get to choose where those boundaries are, not other people. So I want you to think about the last time, or maybe a recent time, that you experienced some sort of health-related concern. Maybe you've had a stuffy nose and you need to go to the pharmacy to get something to help you with that because you're really blocked up and it's getting to be annoying. So go and you see community pharmacy, and the first thing that they're going to do, hopefully if they're doing their job, is they are going to ask you for some information about it. And this can be, maybe they ask you some questions, okay? How are you feeling? Can you tell me what the problem is? And you're deciding whether you permit them access to that information or not. So you either tell them or you don't, and you choose how much you want to tell them. And then the pharmacist uses that information to develop some sort of plan. And in the case of this, it would be choosing some sort of product that, might be able to address help you with your stuffy nose, but also be suitable for you to use and that you agree with. But it's your job to implement the plan. You still have to purchase the product. You have to use it as prescribed. And then hopefully, your concern resolves. That's what we want. That's the whole point. So, but sometimes it doesn't, okay? Maybe you go home and the pharmacist has given you a decongestant and your nose just continues to be blocked. And oftentimes it's associated with achieving a good outcome depends on the quality of the access to information that is provided. So maybe, just maybe, the pharmacist decided that they didn't really have time to talk to you about your nose issues, and they didn't really ask you questions that to find out what the problem was. And maybe they ended up giving you a decongestant, but you actually had allergies and you needed some sort of steroid nose spray, maybe an antihistamine. But they didn't know that because they didn't seek access to the right bit of information. Or perhaps you didn't want to tell the pharmacist because maybe you thought they didn't know what they were talking about. Or maybe you were in a hurry and you just wanted to get the Sudafed and get out of there. And so when they asked you questions, you didn't answer truthfully about what your symptoms were. There are all sorts of reasons around this, but the core thing is that we need to have information to develop, appropriate treatment plans and get good outcomes for people. And one of the things that really influences access to information is people's trust in their healthcare providers and whether they trust them with that information, and their trust in the system, in the healthcare system, that information that they disclose to the healthcare system is going to be kept private and confidential.